It's an honor to welcome you to the Mayor's third annual Housing Forum. We've been proud to be a part of the forum for every year that it's been in existence, and I'd like to thank the Mayor Hancock Office and the Economic Development team for inviting us to participate once again. I also currently serve as chairman of the Denver Metro Chamber of Commerce, where we've committed to help strengthen the relationship between business and local government. Chase is proud to support the ongoing conversation of creating affordability and economic opportunity for all residents. As you may know, in 2016, we contributed more than $5.3 million to charitable organizations in Colorado, including a $4 million three-year grant to support the Denver Public School Career Technical Education Program, and other grants that support organizations such as the Community College of Denver's Advanced Manufacturing Center, Action, Mikasa, Goodwill, and others. We're also pleased to sponsor Denver Startup Week for the 5th straight year. And last year, we announced a new initiative, Partnerships for Raising Opportunity in Neighborhoods, or Pro-Neighborhoods. This $125 million 5-year initiative identifies and supports solutions for creating economic opportunity in disadvantaged neighborhoods around the country. We build pro-neighborhoods based on insights from our CDIFI partners and collaborators. In 2014, we invested $33 million into 7 collaboratives to grow small businesses, create healthy food options, and preserve affordable housing. For instance, Colorado Enterprise Fund participated in the Refresh collaboration with 3 other CDFIs. We've been able to significantly expand access to healthy food across the state. And the collaborative led by the National Association of Latino Community Asset Builders included Colorado Housing Enterprises, or CHE. CHE administered pre-development and construction loans for a total of 118 affordable housing units in rural Colorado. As you can see from our charitable contributions we make in the community, our corporate responsibility agenda is focused on helping address major economic and social challenges by expanding economic opportunity and driving more inclusive economic growth. Unlike traditional models of corporate philanthropy, we rely on robust data and research to target our investments towards solutions that work. We believe the cities offer the greatest potential to drive economic growth, opportunity, and large-scale innovation. We work with local leaders to help them develop strategies and bolster the long-term vitality of the world's cities and the communities within them. All of us are in the room because we want to help strengthen Denver and create affordable opportunities for families to thrive in the city we love. To help address these issues, we've partnered with the Urban Institute over 5 years to support research and analysis on cities around the country. It is our hope that having timely, relevant data will help inform local leaders and decision makers so that we, as a community, can develop strategies that help and advance economic opportunity for all. Therefore, I am pleased to introduce Diane Elliott, a senior research associate at the Urban Institute. She will be presenting the findings of a new report, it was just released yesterday, entitled Denver and the State of Low and Middle Income Housing Strategies to Preserve Affordability and Opportunity for the Future. The report looks at the demographic, economic, and housing changes that have occurred throughout Denver's neighborhoods and focuses on housing affordability to low and middle income residents, those such as nurses, teachers, retail workers, and wait staff who contribute to the success of our city. Diane will report on the findings from conversations with key affordable housing stakeholders in Denver and the programmatic recommendations that the Urban Institute proposes to address workforce housing issues. Thank you for being with us here today, and please help me in welcoming Diane to the stage.
Thank Well, thank you all so much. It's really, truly a pleasure to be here. As was just mentioned, this report just came out yesterday. And as backdrop, we met with Rick Padilla and members of OED at the beginning of February. And Rick said to us, we're going to have this housing summit on May 19th. When do you think the report can be done by? And without skipping a beat, I said, May 18th. Yeah, we'll be ready. So sure enough, yesterday the report was released. It's great to be here. As was referenced, this is part of a series. So we're looking at a couple of cities and low to middle income housing affordability issues, not only in Denver, but also in Miami, where I got to meet Michael Liu, and also in Austin, where this really resonates. This is not just a problem that you're facing here. This is a problem that people are facing across the nation. So without further ado, I'm going to jump in. Actually, let me give a little bit of backdrop. The reason we're focusing on low to middle income households is because they're households that don't typically qualify for subsidies, but they're households that also have trouble affording market rate rents. And these are the households that keep the economy going. So you've had tremendous economic success here. And a lot of that is because you have people like waitstaff, retail workers, teachers, nurses who keep the economy going. So there needs to be a place for everyone to kind of work, live, and thrive and prosper in the economy. So, all right. Having trouble. There we go. Okay. So again, this report was funded by a grant from JPMorgan Chase. So more information about our funding principles is available. But I do want to give a special shout out to Yvette Ruiz, who's here, who's been so instrumental in making lots of connections and helping us here. So thank you, Yvette. And also, I want to give a special acknowledgement to all of the stakeholders who helped us inform this report, many of whom are in the audience. This is a tremendous community here. We were really struck by how innovative and collaborative you all are together. There's great hope in Denver for setting a national example. Okay. So as just sort of a brief overview, again, we're exploring low to middle income housing in Denver neighborhoods. The focus on neighborhoods is really how communities, developers, and planners think about these issues in cities. And we're taking the same approach in all three of these cities, in Miami, Denver, and Austin. So there's really a point of comparison across the three. And not only do we take this really rich data dive, but we couple this with the stakeholder findings. We talk to so many people in the community about some of the opportunities and barriers, and that's included in the report as well. And then we offer programmatic ideas that really could work in this context, given what we heard and what we know from other places. So today, I'm going to present the stakeholder themes and the programmatic ideas. I'll say, though, that the report is over 100 pages, so if you want some light reading, you can go ahead and see the data-rich piece that I was referencing. Oh, there we go. Okay. So there's been tremendous change, of which most of you know already. Denver grew by 128,000 residents between 2000 and 2015. To put this in context, this is like growing the size of Topeka, Kansas. So that's a lot of people to kind of come into Denver in that time. Growth in some neighborhoods was really extraordinary. So for example, downtown areas, the population doubled. And a lot of that is because of this new development. And the new arrivals to this area were younger, white, and higher income than longtime residents. Over half of Denver's households are renters. This has changed very little since 2000. So just to kind of put that into perspective, it's not that the renters have changed, it's that the cost burdens have changed. There we go. So the renter cost burden between 2000 and 2015 really grew for certain income categories. So if we look at the very low income group, this was a tremendous burden. And what is housing cost burden? It's when households are spending 30% or more of their income on housing. So this grew from 60 to 82% for very low income households and grew from 7 to 26% for low to middle income households and was unchanged for those high income households above 120% AMI. So now I'm going to sort of quickly go over the themes that came out from all of our conversations with stakeholders. Again, 4 themes: extraordinary population growth. We see this in the data. We heard this from everyone we met with. And it's really changing the landscape of housing and demand for housing. Displacement was referenced in nearly every conversation that we had. This is something that intersects with race and equity in the city. Denver, you're very innovative when it comes to thinking about affordable housing policies, right? But the demand and funding, it's just a lot of demand to keep up with the pace. And then market rate development really flourished in recent years, while affordable housing development has not kept pace with the demand. And we'll talk a bit about the insufficient incentives and unintended policy consequences. There we go. So this extraordinary population growth piece, we heard that rapid growth and in-migration to Denver is changing the city. And this is really changing the demand and creating a lot of demand for market rate rentals. At the same time, creating inflation throughout the whole of the housing market and rental market in particular. Okay, displacement. Again, mentioned in nearly every conversation that we had. It's very notable in Black and Latino neighborhoods, which are, had typically been very disinvested in over time. So this is really something to think about in terms of race and equity, and it's one of the recommendations that we make. It has direct impact on children. So, for example, that lovely video that showed the family being able to stay in the neighborhood where the school was across the street, that's so important for kids and for their educational outcomes and eventual success. So this really intersects with economic mobility as well. And we did an in-depth profile of Globeville. There's a lot of stress among the children and families in Globeville because of displacement. And we heard, too, that families are being displaced not just within Denver, but out of Denver and being displaced multiple times sometimes. So this is really a regional issue, and it draws up sort of questions about how can prosperity be shared, because it doesn't seem as though this prosperity is really being shared right now. Sorry, I'm having some problems here. There we go. Okay. Denver is innovative and collaborative. This was something that came up over and over again in conversations as well. You have this new Affordable Housing Trust Fund, the Office of Hope. You've been a national leader in TOD. But the funding is still not, it's perceived as not being enough given the challenges that you're facing. And the cost of land really makes affordable housing challenging here. So some of the innovations I'll talk about in a bit, but there could be some really great opportunities for innovating in this space. And development incentives. So they're just not meeting developers' needs for kind of creating more affordable housing. And part of that is because of unintended policy obstacles. So we heard a lot about the construction defect law and disincentives to create condos, which then has a ripple effect throughout the whole market. There's unmet demand, lots of pressure being created in this space on market rate rentals. There's issues with collecting taxes and using that to leverage that money. There's also issues with rent control, which we heard in the gentrification panel. There's not a whole lot of leverage that you have here because of Colorado state policy in this regard. Can somebody give me, oh, thank you. Okay, so let's talk about the program recommendations. Somebody give me a hand. The clicker's not working well. Thank you. Potential of accessory dwelling units. So this came up, it's not only in the HOPE memo that just came out, this came up also in conversations about gentrification. ADUs have the potential to increase affordable housing. An ADU is it's a secondary unit, could be attached to the main house, could be detached, and there's this great plan to pilot this in West Denver. But as one stakeholder pointed out, you have to ensure that affordability is built into the system. And this is really important because otherwise it could contribute to gentrification. So, for example, you can look to other municipalities and see what they've done in this regard. And we offer 2 examples in the report. We look at Minneapolis, which really relied on a lot of community investment and community capacity building, and sort of took the community's concerns at heart and created policies that reflected that. Santa Cruz offers 7 pre-approved plans for ADUs that conform to the city's standards, and so it's already created it. It sort of makes it a more efficient process. Next slide. So community land trusts. You have examples of community land trusts here. Community land trusts could be utilized in even greater capacity here. So a community land trust, for those who don't know, is a nonprofit community-based organization that holds the land and ensures affordability permanently, in perpetuity. And there are a few CLTs operating in Denver. We heard that there are commercial examples. Urban Land Conservancy and the GES Coalition for Health and Housing Justice are exploring this right now. And what's really interesting about this exploration is it could be single-family, non-contiguous properties that would be preserved in perpetuity. CLTs are highly capital intensive, but again, the permanence of it is built in, which is really key. And a side alternative here is to transfer publicly owned land, which could also then be held as a land trust and, again, preserve that affordability. Next slide. So this gets to this incentives piece. The incentives we heard from many stakeholders just aren't enough, or the right kinds of incentives to make affordable housing creation and development attractive. So one of the things that we raised here, we also raised this in Miami, is that to the extent that you can make permitting a faster process, it saves developers money in the end, and it saves a lot of time. You get those units created faster. So we offer the example of Pinellas County, Florida, which has a 2-week turnaround on creating affordable housing projects. So it comes into the permitting office, and 2 weeks later, it's out the door, and the project can start. We raised this in Miami, and some of the folks around the room that we raised this with said, what if we could get everyone in the room at one time and just go through and kind of make all of those checks at the same time? So I think there's a lot of ways to kind of make permitting a faster process. One of the other things that we see just here, and also we heard here, we also have seen nationally, it makes a big difference, is cutting down on fees. And this is especially important for smaller projects, which if there are flat fees, tends to take a really big chunk out of that budget. So Portland was offered up as an example. So they have system development charge exemptions. And I know that we have someone from Portland here. Perhaps he can answer those questions after the fact. But again, the rising cost of land is a challenge. So whatever can be done to make it lower cost for developers is really key. Next slide. Social impact investing. This is an idea which, you have social impact bonds, which are, one for homelessness, which is really quite, it's held up as a model nationally. So what if you all could think creatively about a way to do this for affordable housing? We brought this up in a chamber meeting yesterday, and already the ideas were flowing. So it's really exciting that this could have some momentum to build up that fund. Another option here is, for example, San Francisco has an housing accelerator fund, and it's very new. There aren't a lot of outcomes yet, but it's something to kind of keep an eye on. And then Housing Partnership Equity Trust. Now, this and Our Stone, they're examples of ways that small investors who are socially minded can say, I believe in my city, I want to invest in my city. Here's some money, my investment money, that can go towards that, and maybe I can get a return as well. Next slide. Tenants' rights. This came up over and over and over again in conversations, but it's a challenge in Colorado. There's a great national analysis that just came out that looks at states, all the states, and sort of where they land in terms of being pro-landlord, pro-tenant, and where Colorado lands is on very pro-landlord, very much the pro-landlord side. So there's not a lot of weight or meat to be able to, sort of advocate for tenants. there are a couple of opportunities. So one opportunity that we heard was if the city can control sort of publicly owned land and sort of preserve that affordability for prospective renters. Another idea, or at least something that's in the system as well, is this right of first refusal. So the challenge for renters, and we heard this in the gentrification panel about people who were losing their homes as they were sold. They have the right of first refusal, but they often don't have the capital to put a down payment down. So there's a creative program in Texas, that Texas State Affordable Housing Corporation, which we heard about in our Austin calls, which gives a grant to homeowners or to renters facing this very situation, a 5% grant towards the purchase of their home, and also helps to negotiate longer terms to be able to find financing, which is also an issue, right? It's often very quick turnaround, but this could be a great program, right? Just a grant program, which could be sort of, help a lot of people stay in place. Next slide. So if there's one theme that came out over and over again about displacement, it really intersects with issues of race and equity. So along those lines, there are examples out there, and I think Denver could really be a national example in this regard, where race and equity is built into everything that is talked about and thought about in terms of affordable housing. So for example, Portland and King County, Washington, this is built into the governance structure. You look at the documents and there's an explicit mission about this. So there's examples here. For example, the United Neighborhoods project in GES is a model where it's really talking to the community, getting a lot of community engagement, really thinking about this in a very race and equity way. So there's really an opportunity here for Denver to be nationally known for being sort of a pillar of pulling race and equity into these conversations. Next slide. Creating more apprenticeship opportunities. This is something that we have put up there because it's clear that renter cost burden and housing cost burden, it's not simply a function of rents and housing values and housing prices going up. It's also a function of a lot of families having really stagnant or declining income. And this is due to a lot of factors going on here. There's increased volatility, there's wages haven't necessarily kept up with inflation. So if there are ways to kind of bridge this gap with workforce development ideas, it could be really, really powerful. So we put up, for example, an example of an apprenticeship opportunity. There are many other apprenticeship opportunities out there, but to whatever extent those can be leveraged and can help these families also build their income, this would be a really important piece to think about. Next slide. So one of the other ideas that we draw upon, we referenced this in Miami. We pulled this example actually from Texas. Can LMI families stay in gentrifying neighborhoods with tax increment financing? What this does is you could create a neighborhood zone, and any increased property values as a result of the neighborhood gentrifying, those increased property values, a percentage of that could be harnessed and then applied towards maintaining affordable housing in that very neighborhood. So you don't have to displace people within that neighborhood. So again, in Austin and Dallas, they have these designated neighborhood zones where the increased property value money that's accrued is used towards affordable housing. And Denver could create TIF zones in gentrifying neighborhoods. It could be used for a host of ideas, but it could be a way, for example, in rapidly transitioning neighborhoods such as Globeville and Elyria, Swansea, it could be a way to help people stay. Next slide. What we heard is that there's not a lot of incentives for landlords to maintain their naturally occurring affordable housing as affordable. For example, and this is mostly mom and pop landlords that I'm referring to here. So helping landlords, for example, with repairs is not a strong incentive. One of the things that we heard is possibly tax abatements could be a stronger incentive. So we list here an example from Chicago where if they can agree to keep their units affordable for 10 to 15 years, which again, that could be negotiable, perhaps it could be a longer term negotiation here, then they get tax abatements. So it could be a really nice way to sort of skirt around the Telluride decision and rent control issues that you have here. Next slide. This is sort of the final, piece here. Is displacement is not just a city of Denver issue. This is really a regional issue. So the conversations that we had with the stakeholders really suggest that families are being displaced in short order to the suburbs, and then after that, perhaps being displaced again in short time. So we've sort of looked at past examples of what you've done here in terms of regional coordination. It's really, really impressive. So if there's a way to kind of have more of those regional conversations, put this more on sort of a regional platform, again, Denver could stand out as a national example of how to think about this in a regional way and how to make really great progress for families who need it. Next slide. So next. So again, just to recap, Denver's really characterized by this really high awareness of affordable housing needs. The fact that you have this summit and you've had it for a couple of years is really, it's notable. And we noted a lot of cooperation and collaboration with diverse parties. Again, this is really sort of, it's such an opportunity here in the city. The population growth is making things really challenging though. And there's a lot of short-term strategies though that could be implemented in short time, right? Creating an affordable housing policy around ADUs could be really exciting and innovative. Social impact investing, if there's a creative way to harness that, it could create a lot of money for the Affordable Housing Fund in really good time. And then greater use of community land trusts. In the long-term strategy, have this regional vision and have it surrounded around issues of race and equity. This is really important for thinking about how the whole region is going to share in this incredible growth that you've had in your economy, right? All residents should benefit from this potential that you have here, and you really have the opportunity to stand out and create that for all of your residents. So that's my final slide. Thank you all.
All right, let's hang in there. We're almost there. We're almost there. We have, I want to thank Diana Elliott, the Urban Institute, and JP Morgan Chase for the illuminating insight and research into what's happening in the Denver metro market. I'm really excited to kick off the final plenary session this afternoon by welcoming our keynote speaker, Jonathan Rose. Jonathan is the president and founder of Jonathan Rose Companies, a real estate development planning, consulting, and investment firm based in New York, but with deep roots here in Denver. You saw some of that with the ARIA development. His partners, Susan Powers and Chuck Perry, have done a tremendous job out there, so we appreciate your New York spirit and investment here in Denver, to be sure. Jonathan is also the author of a recently published book, The Well-Tempered City. Let's stand, stretch, and give Jonathan that Colorado welcome. Stand up and stretch. We got 1 hour left. Let's go. But don't leave.
Thank you. I like that stand and stretch. Thank you, Rick. It's really wonderful to be here. I've actually been working in Denver since 1990 when, with Chuck Perry and Jerry Glick and Sue Powers, I helped redevelop the Denver Dry Goods building, and it's my favorite city. I mean, you have amazing spirit, and the growth and development that has happened here is extraordinary. I'm actually going to take this off. I remember in 1990 actually talking to people about the need for affordable housing and people thinking I was nuts. I also talked to people about the need for downtown housing and people thought I was nuts. It's amazing how Denver has so successfully, from mayoral leadership to mayoral leadership, handled the issues of transportation and growth and job creation. So if this will work, okay, let's go back. Okay, so what I want to talk to you about is one simple idea, and then we're going to have a fantastic panel discussion on this idea, and it's how do we develop communities of opportunity? In my book, and I'm going to talk very briefly about this, we go back to the very beginning of cities. Actually, I look from starting at 12,000 BC, but in 1752 BC, as cities were really quite well underway, the capital of Babylonia was taken over by Hammurabi, and he created the first urban code. And in it he said that his mission was to be the salvation-bearing shepherd, that a good shadow is spread over my city, that the strong may not injure the weak, to protect the widows and orphans, to speak justice in the land, to settle disputes, to heal injuries, to further the well-being of mankind. And I raise this because this idea of justice, this idea of well-being, this idea that we were going to protect all is actually in the very roots of urbanism. Doesn't this language sound biblical? It's in the roots of our civilization. And it's something that's actually these founding core principles of cities are something I feel that we have lost and we need to reclaim, and that Denver is actually a leader in doing that. This is a map of intergenerational mobility in the United States. In 1940, if you took the bottom quartile of people of income in the United States, by the time their children were 26, 90% of them were earning more than their parents. That was the American dream. Today, 32% of their children, so less than half, we are going backwards, are earning more than their parents. And if we look at the distribution of this in this chart, the deeper the red, the less likely a child will do better than their parents if they're in the bottom quartile of income. So we're going to look at several things that are going to show us that our destiny is determined by our zip code. And our destiny is determined by the counties in which we live. These are county maps. And I really believe if we're going to honor the American dream is that every child should have equal opportunity to thrive. Interestingly, Denver is now the 5th worst of the top 30 cities in the country in terms of income inequality. And there's 2 areas that this affects all families, but the region will, by 2030, the region will have more than 500,000 more seniors. Seniors will make up 19% of the population compared to 9%. So this population is also aging. And due to the growth of seniors, the population with disabilities will increase to 237,000. That's going to put huge stresses on our healthcare systems. Children today are about a quarter of Denver's population, and 12% of children under the age of 18 are in families of 3 whose income is less than $5,500 a year, which is 30% of the poverty level. It's incredibly low. And so although we should think about inequality for all people, these are 2 sectors, children and seniors particularly, to think about. The Denver Department of Children's Affairs actually put out this chart of the Children's Well-Being Index. So just as I showed you nationally how there's huge disparities, there's also local disparities. So in this chart, the deeper the blue, the less likely that a child will end up being able to read at the 3rd grade level, graduate from high school, and have other conditions of success. So even here, we have not yet equalized the landscape of opportunity. We already saw this chart, so I'm going to skip over it. So there are several issues. So the first is we know that America now has more suburban poverty than urban poverty. We can see that there are vast amounts of young millennials coming into Denver for great jobs. They are higher income, and that they are displacing lower income families who are moving further and further to the suburbs. This happens to be from Colorado, from the Washington, D.C. area, but what we see is that poorer people then move farther away to find cheaper housing and end up spending more. They're not actually saving money. Their housing cost is going down, but they're spending more money on transportation. We also have the issue of income itself. I love this quote: "Nobody aspires to work 2 meaningless jobs and collect food stamps." And we have created an economy today that is very bifurcated, in which a group of people are doing extremely well and other people are working very, very hard. We heard today that 80% of the people who are in the homeless system in Denver are working. People are working very, very hard. It used to be, going back to that 1940 and even 1950, that if you were a 26-year-old and had a job, you could afford to buy a good job. But being a postman, being a union worker, being a construction worker, at that age you could buy a house with a single working person in a family, and that's pretty much impossible today. Along with this, we have created we're a much more consumer economy. We have a lot of cheap and very unhealthy food that people are eating. And the future of work itself is rapidly changing with automation. When you look at all the strategic planning for cities and strategic planning about housing and poverty, et cetera, I don't really see ambitious thinking about what's happening with the very nature of jobs, which is how people are going to afford to live. This is a car production plant. There's 2 people in the photo, the whole photo. The rest is all automated. And we're going to see automation rapidly taking over a lot of low-income jobs. I know somebody in the fast food business who said, if you raise my minimum wage from $7 an hour to $15, I'll just automate it. And by the way, the robots have already been made. You can actually go online and see pictures of what a robot looks like that can work in a McDonald's. There's one other thing I want to put on the table, and then we're going to talk about how communities of opportunities can be solutions to these issues, and it's the issue of adverse childhood experiences. When a child experiences abuse, such as emotional abuse, sexual abuse, physical abuse, family dysfunction, such as a parent going off to jail, domestic violence, mental illness, parental divorce, substance abuse, and neglect, each one of those is called an adverse childhood experience. And when a child every time a child experiences it, it puts them in the flight mode. And when they're in that mode, they're very fearful. They can't make connections. When they have 4 or more, their brain permanently goes into the flight mode. And it actually affects their neural development. There are actually parts of the brain that shut down and do not grow. And what that means is, for example, the child can't learn to pay attention because their brain is always looking around for threat. So they do very, very poorly in school. We say they have ADD. They don't make friends, and yet we know that social networks are key for human development. They're literally the parts of their brain that trust and connect with other people are minimized. And so without trust and social connections, they don't form bonds of friendship. When they hit puberty, they switch to the flight mode and are much more likely to join gangs and have high-risk behavior, teenage pregnancy. From a health point of view, we now know from initially huge studies done by Kaiser Permanente and now many others, that if you have 4 or more ACEs, you are more than twice as likely to have arthritis, asthma, cancer, COPD, diabetes, heart attack, kidney disease, stroke, vision problems. These are diseases that we associate with poverty. They're also, by the way, in the Kaiser study, we saw that this is significantly affecting college-educated and white populations too. There's a mental health and a physical health consequence that comes with trauma and traumatized populations. So one of our challenges is when we talk about creating communities of opportunity is how do we create communities that have a deep sense of safety, nurturing, and support within them, because that is essential for the future of our children. We know that people with 6 or more ACEs are statistically likely to have a 20-year shorter life. We know that it costs society, from incarceration and school costs, et cetera, and healthcare costs, about $124 billion per age cohort. That means all the 4-year-olds today for their life will cost society $124 billion. And next year, those 4-year-olds, another $124 billion, and so on. We also know how to solve this problem, and it begins with the reallocation of money. This is the total healthcare investment in the United States, in the OECD countries. The blue line is how much we spend on healthcare. It's hard to read this chart, but the United States is by far the highest, almost twice as high as the average spent on healthcare. Look at the red line, and that's how much all the other nations spend on prenatal care and social services and free daycare and social and affordable housing and better health care. And what we see is the total cost, when you combine half, if you spend twice as much on those things and half as much on housing, you end up getting, the total cost is less. And if you look at our health outcomes and our education outcomes versus the other OECD countries, they're performing much, much better. So the integrated strategy that the mayor released this morning with this wonderful hope concept, the total integration concept, this idea of community of opportunity, is not only the right thing to do, it actually turns out to be the most cost-effective thing to do. So a community of opportunity has the following constituents. It starts, if you look about 5 o'clock on this chart, with affordable housing. We now know that you need a stable base for all these other things to happen. Ron Terwilliger, who is the head of the chairman of the Board of Enterprise Community Partners, says it's very hard to do homework when you're living under a bridge. We know how important livelihood or jobs are, that income is a critical component of the success of a family, but income can only take place if there's good education. And the reason I brought up the issue of automation is the only way we're going to work our way through that problem is to have people who are superbly educated, not only with knowledge, but with cognitive capacity. The jobs of the future are going to require vast integration skills, strategic planning skills, social and emotional intelligence skills. Those are the things that computers are going to get to later. And to have those, we need mental health. And the mental health goes back to not having adverse childhood experiences. And so we really need to tie together the housing, the education, the healthcare system. We're going to talk about that later today. We know parks and open space are critical for mental health, for physical health, for exercise, neighborhoods serving markets and fresh food. I have mentioned several times this cognitive capacity needed to thrive in the 21st century. And arts and culture are important not only because they enrich our lives, but they are important because they teach us to think symbolically. Access and transit, we know how important mass transit is, cheaper, affordable transit, multiple modes of transit. And then there are these three other components, which are the soft components. But one is called collective efficacy. Very interesting studies by Robert Sampson of what makes neighborhoods thrive in Chicago. And it was the sense that people could work together as volunteers, and that by doing so, they were effective. They made a difference in their communities. A sense of justice. People need to trust that their society, to believe that if they do the right thing, the society will do the right thing for them. And too often today in the United States, particularly around racial issues, we are growing the sense that it may not be a just system. And the last, which I will end the talk with, is about compassion. We must all believe that we are all in this together. These issues can only be solved by a vast integration. As an example, this is a project we completed recently in New York City. It's affordable housing designed to enterprise green communities guidelines above, but below is a fantastic charter school. I'll just briefly show you some very light, airy, connected to nature, even though it's in the heart of East Harlem. But in addition then, we have homework help rooms in the affordable housing. So we're connecting the housing and the education. So there's computer rooms and people who work with the kids. So only a quarter of the kids, less than that number, this is a community serving school. So actually very few of those kids live in our housing. They live in public housing and other places around nearby. But we have said this is an educational campus. And so every child who lives in our project has access to after-school help and computers, etc. We know that there are a lot of solutions to this issue of adverse childhood experiences. It takes integrating the health system, the mental health system, the school system, but that when a traumatic event happens, actually with meditation in a form of yoga, because stress is embodied, if you do that within the first 90 days before the trauma locks in, you can help relieve it. You need cognitive behavioral therapy, family therapy. Meditation alone doesn't work. We're implementing now telemedicine. So you can measure with this little device the blood pressure, blood oxygen level, and pulse of residents. We're doing this now in affordable housing. That goes off to a medical center where it's analyzed, and the medical center is sending us back recommendations on diet, exercise, and medication. So we are integrating. It's not just a medical thing. We're looking at healthy food and we're looking at exercise, those components together. And in this particular project with formerly homeless women, senior women in White Plains who had 1 to 2 different conflicting conditions, we actually reduced, this telemedicine program reduced hospital emergency room visits by 41%. So there's a real cost savings to this. One of the things we have to now figure out is how do we integrate, how can we create housing-based solutions that provide, that then can cycle or share in the cost savings that they're generating. There are 2 zones in which we need to do this. We need to do this in both new construction and in preservation. So I'm going to end with examples of both of those. Our company has a fund that buys existing affordable housing, preserves its affordability, commits to long-term preservation, uses many of the tools that we heard earlier from the Urban Institute, such as we work in communities where we get tax abatements and we use the low-income housing tax credit. This is a 379 unit Section 8 project in Manchester, Connecticut. We got a tax abatement and we got a markup to market and we got a tax-exempt bond, low-income housing tax credit financing. We allowed us to put $15 million into renovating the units, making it very green, put 200 kilowatts of solar on the roof, designed at Enterprise Green Communities guidelines, but we put $2 million from those resources into this community center. A place where the whole community gathered. There had been nothing for the community. So when you look at how do you build collective efficacy, you need the ability to have the collective. We began to, we the owner, put in the capital improvements for this, and we fund one social service worker. That's our only cost. The rest is we kicked this project off, by the way, this opened March 1st, with 20 partnerships with local community not-for-profits and for-profits. So for example, the library has a program where they teach parents, so we know through our health care provider who's pregnant, they reach out to pregnant parents and they teach them about reading to their children and give them the books to read. I Pat the Bunny and all those books. Those low-income families don't have those. They give those to the kids so that they start a reading culture at home. We teach English as a second language on site. We teach computer skills so that our people, even if they're working, can move to higher level jobs and income. We have a kitchen, and another not-for-profit teaches how to cook healthy food, because remember, we're doing this triple prescription of food, exercise, and medication. We built 2 healthcare exam rooms on site, and the Eastern Connecticut Medical Association is providing free preventative health to our residents because it's cheaper for them to do it on site than to see them in the hospital emergency room, and they get Medicaid and Medicare reimbursement for it. Again, I mentioned that we actually prescribe exercise. We have an exercise room. The food, very low-income people often don't eat much during the last week of the month because they run out of food. So we have a food bank that comes twice a month, and it brings healthy food that ties into the prescriptions that the medical system is prescribing. We also have community gardens and teaching our residents to grow. I mentioned arts and culture. We're growing arts and culture with our children. So that's what you can do in affordable housing preservation. And I'm going to end with what we're doing at the ARIA project in northern Denver, right opposite Regis University, with my partners Chuck Perry and Sue Powers. We took over an old convent site and we asked the question, how could we create a community that cultivates life? Is there a community in which the idea of health and growth, the growth of the individual, the growth of the environment, was embedded in the very nature of the project? And so you'll see that things that are stripy looking are the community gardens. This project has, if you start in the lower right-hand corner, the ARIA project you saw a little bit in the movie, of low-income housing tax credit project. It has for sale townhouses that have condominiums, has apartments, it has retail that's about to start construction, has a co-housing piece in an old convent that was just created, and we were talking about actually having a piece of affordable home, first-time home buyer buyers in this. So this is one of the townhouses. This is the tax credit rental apartments. By the way, they're all woven with nature within them. There's a partnership with Regis University in which they're actually teaching our residents about organic gardening. Again, as health is exercise is built into the heart of the project. This is the convent, which has just been converted into the co-housing. This is the retail piece that is about to start. By the way, this is the first time this image has ever been shown in public. This is the retail piece that is just about to go into construction soon. But most importantly in this project, we partnered with the Denver Health Foundation and their Cultivate Health program. And we're going to hear more about that later, with the idea, working with Regis University, could we really create a culture of health within the project and also have that radiate out within the neighborhood? Because one of the lessons is that as much of this vast integration I'm talking about needs to happen on project level, it also must touch the neighborhood. I want to just briefly talk about the neighborhood. It is a neighborhood that, because it's on the very north of Denver, has been kind of ignored. When we started here, the average home price was $162,000. It is now, just because of the thriving of the Denver economy, $325,000. And so the issues of displacement are rapidly hitting this neighborhood. The education system has not advanced in terms of, so people's job skills have not doubled, but the cost of their housing has doubled. When we finished the ARIA project, the first tax credit project, we, within 3 months, had a waiting list of 1,200 local residents who were desperate to move in. We only had 62 or 68 units, so we couldn't accommodate them. They call us every month and ask. So the pressure, they ask, when, has a vacancy opened up? Has a vacancy opened up? Because the pressures of gentrification, this mismatch of the pressures of gentrification as neighborhoods rise versus the affordable resources is a bad mismatch. At any rate, so that was my point, was that we're trying not only to create projects, but we're trying to have them radiate out through the whole community, and the Cultivate Health program was the one that really helped us do this in partnership with Regis. So on our site, we created permanent, affordable community gardens, which not only sell affordable food to the community and provide food to the local elementary school, but also obviously to our residents. And there's with Groundwork Denver, we built a greenhouse. So this is also providing job training in terms of food production and agricultural food. This is Father Fitzgibbons and the mayor here at the first great carrot picking that took place in the community gardens. And we have a summer youth program that is training kids about healthy food, also connecting with nature and teaching them about foods and agricultural skills. The Cultivate Health program also has brought yoga to Zuni Park. So it's not just about what you eat, it's about how you live. We've focused on much more walking, much more exercise, and that brings us to the bicycles. So we started a bicycle program at Beach Court Elementary School, and the principal told us that's great, but the kids don't have bicycles, and so this program arranged for 300 bikes to be donated so all the kids could ride to school. And also then a healthy initiative with the food preparation in that elementary school, and that's radiating out to other schools. We're teaching recycling in the neighborhood. This is all came out of this Colorado Health Foundation grant. Very, very high leverage when you begin to say that health is not just something that happens in the hospital or in the doctor's office. It happens in the building, it happens in the community, it happens in the schools. So I want to end with this, which is where I mentioned before, which is this idea of compassion. We made a major change in civil rights in the United States because in the 1960s there was a sense that the system was wrong and that it needed to be changed, and it needed to be changed now, and it was something that we had to all do together. That change was imperfect. There's still much more to go in the path of civil rights, but certainly we made big progress then. And in this idea of integrating housing, health, and education, we are on the verge of that change. We also have to realize that requires collective action, that we must all be in it together. We must integrate our silos. I hope I've given you some examples of how to do that. There is much, much more that we can be doing. I want to end with this quote from Christopher Alexander, an architect, who said that making wholeness heals the maker. As we make wholeness in the world, it actually heals each one of us individually. This work, which I am really calling for all of us to do together, is amazing work. It's deeply satisfying work. It's work that gives our life purpose, and it heals us too. So with that, I want to call up our panel. Thank you, and we're running a little late, so normally I would take questions, but maybe we can ask the questions to the whole panel. So joining me now will be Brian Espacher, who is the Executive Director of Planning Enrollment for the Denver Public Schools, Kang Yin, who is the Portfolio Director of the Colorado Health Foundation, and James Corbett, who's the Senior Vice President of Community Health and Values Integration. I love that title, Community Health and Values Integration at Centura Health. So thank you all for joining me. So what I thought first is we would just hear from each one of you, just very briefly, what are you doing in terms of this integration of housing, health, education? Where do you see the opportunities? So James, why don't we start with you?
Great. So happy to be here today. My name is James Corn. I'm the Senior Vice President.
I don't think your mic's on yet. I don't think it's up to you. I think it's up to them. Try again. Yeah, great.
Okay, I'm on. Excited to be here today. I'm a Senior Vice President at Centura Health. Centura Health has 17 hospitals, 22,000 employees in Colorado and Kansas. Hospitals such as St. Anthony's and Mercy Hospital and the like. So today I want to talk about my areas of expertise: ethics, behavioral health, community health, research operations, global health, and spiritual care. And I'm going to start with somebody with a law degree and a Master of Divinity by happily following up on some of the theological themes that were mentioned earlier. I think a common test of the morality of a society is its treatment of vulnerable populations. And in our city, we have a vulnerable population that needs the housing and deserves that housing. So from my perspective and from healthcare in general, there's a better understanding that we need to move from a narrow notion of health, medical care, to a broader notion of health, which includes the social determinants of health, things such as housing, education, employment. And it is one of my responsibilities to ensure that we live up to that. So historically, in my role and other locations and things we're doing in this state, we've worked on housing hospital partnerships. As you can imagine, it's important that we have stable housing for individuals, particularly those individuals who might be in a lower wage setting, such as those who work in the kitchen or maintenance. So I've been a part of building housing locations in other states, and it was a great public-private partnership. In addition, we do a lot in terms of community gardens, farmers markets. We recognize if we're asking someone to improve their health outcomes, that if they don't have healthy food, that's unlikely to occur. We all agree that we live in an environment where there's too much money going to the medical care at the expense of these other areas, but there are things that we can do and should be doing together. Yes, there are structural issues, but I think there's also individual issues of resiliency and ensuring that we don't give up on our dreams and aspirations to ensure that health outcomes can be reached in a better way. And I will tell you that healthcare hasn't always been a leader in innovation. It was a gentleman named Ignaz Semmelweis who first said that washing hands could lead to save lives. He was chastised, ridiculed, and died in an insane asylum at 47. John Snow argued that water could be boiled in order to prevent an outbreak. He also was chastised and ridiculed. He now is known as the father of modern epidemiology. So I say while there are structural issues that we can all address as a system, there are individual things that need to be thought of as well. Innovators, those of you in this room who have ideas, we need to hear those ideas and we need to be open to embracing them. So I'm really happy to be here today. I'm really excited that Mayor Hancock put this on. I'm excited that Rick Padilla is doing this for years in a row. I'm really honored that Eric Sullivan fought to have the language of Spanish spoken in some of these sessions. And to my Latino brothers and sisters in the room, please llámame Jaimito, por favor. Thank you.
So let's stay on, thank you, James. So let's stay on the health theme, and Khan, tell us more about what you've been doing.
Great, thank you. Can you hear me? So, hi everyone, I'm Kai Nguyen. I am not Brian, as you probably saw in my bio, but I might be Brian someday, so.
I have to have a conversation with my boss about that. I was kind of nervous. So, yeah.
I'm the portfolio director at the Colorado Health Foundation for our work in healthy behaviors and social determinants of health and part of our child and adolescent health. And I've worked in philanthropy my whole entire career, 27 years, and have just truly enjoyed where it's gone, really this integration and this whole summit and the talk that Jonathan just gave. So my work started at the foundation with prevention and then moved to childhood obesity prevention the last number of years, last 3 to 4 years. That's where we started looking at the built environment, the infrastructure around us, food access, and began to partner with affordable housing developers at that time. And started pretty small, funding some playgrounds at developments, but then really moved to holistic projects such as Mariposa, Metro West, and of course Cultivate Health, which we're really proud of all these projects. And really realized with all these projects that we needed to think broader about health. And if you ever get a chance to hear our CEO, President and CEO, Karen McNeil Miller, she says everyone is in the business of health, which I think we really truly believe. So think of health broadly. It's not only health and health care, but transportation, civic engagement, education, housing. So we've really embraced that and trying to spread that message everywhere. And also what we decided and built on our work was really now needed to have a broader view of health and broader view of our work to really improve the lives of Coloradans. So the social determinants of health that I just mentioned is one of our newest focus areas. We're defining it right now. Certainly housing would fall into that, and we'll see if it does. But really am excited about that we will have more a view of upstream factors and how we can improve the lives of Coloradans. And I just want to share that a resource that I want to share, just going back to affordable housing. Just as Jonathan mentioned in his examples, we, in building off all these great partnerships with ARIA and Denver Housing Authority and Metro West, we decided we want to go a little step further, and so have partnered with CHAFA. And I saw Tim Dolan earlier. I don't know if he's still here, but he's the lead on this project that we've been working on. We launched a healthy housing fund with CHAFA that is providing very flexible terms loans for affordable housing developers who meet certain healthy principles, building healthy principles guidelines. And so you can get a loan up to $500,000. But if you get a loan, what I think the really compelling piece is we also provided an investment to CHAFA to manage a programming fund that you can apply for a grant of up to 3 years to enhance and activate and promote those healthy, building healthy places principles. So we're really excited, and I hope, don't rush Tim, but if you see him, talk to him about it. But we're really excited to really embody and fulfill sort of what Jonathan's been talking about. So I'll leave it there.
Thank you. And Brian, boy, you have some challenges. A rapidly growing population, big chunk of kids, and a skills gap, not only with what exists today, but the skills we don't even know what they're going to need to be for the future. Yeah, what are you doing?
Yeah, it's we're seeing a tale of two cities right now in Denver, where it's one of the fastest growing cities in the country, yet our student population is now starting to decline because of housing price increases. And one of the schools we looked at in particular this week, in the Sun Valley neighborhood here in Denver, a quarter of the students that started the school year have now left the school, and the school year is not even over yet. When we looked from last year to this year, 40% of the students that were supposed to return to that school did not. And so we're seeing these impacts heavily on our 92,000 students, more than 60,000 of whom still qualify for free or reduced price lunch, and more than 3,000 of whom experienced homelessness this school year. So big impacts from the housing side on students. And when you think of from a Maslow's hierarchy of needs, you need to have that stability at home to then go to the next level up, which I think we're talking about today, which is health. And do students have strong access to health care? Even something as simple as oral care, that's one of the leading reasons of absentees for school. And so needing to build that stability for students. The question you specifically asked is, how do we link the changing job market back into education? Parts of the education model are well over 100 years old, and that worked back then, but it needs to adapt to the modern era. And I think one of the areas that we've invested heavily in, we've been fortunate to win grants from the federal level to the local level, is on Career Connect programs, which is modern apprenticeship models. I think there was a negative stigma in decades past about, if you go to an apprenticeship program in high school, does that mean you're being tracked to a career path that, may be more limiting? But I think as we see in Denver today, some of the jobs that are most in demand are really good jobs, but we have, a huge labor shortage in those areas, whether it's related to the trades or something else. And so we're trying to adapt to many of our high schools by investing more programs in that, knowing that college may be the best opportunity for some of our students, and about 70% of jobs require a college education, but for 30% of jobs that don't, trying to map our K-12 curriculum to those jobs.
Very helpful, thank you. I just want to amplify one thing that you said. There's been a very interesting study that shows that there are, I can't remember, it was 5 or 7 medical conditions that are essential for a child to enter kindergarten. So for example, apparently 20% of low-income children can't see the blackboard and need glasses, but were never examined for eyes, have had a previous ear infection that has made it very hard for them to hear that was never cured So there's a whole series of very simple to solve health conditions that that if we just had a system that looked for those, could dramatically increase early childhood education outcomes. So I'm going to ask each of you now to give an example. I'll give you one kind of leading example of where you see housing, health, education intersection, and tell us about a solution. So the one I'm going to tell you is, I was on a panel with the president of Columbia Presbyterian Hospital in New York, and he said that they looked at their emergency room and they discovered that there were 100 asthma patients whose asthma attacks were actually clogging up the emergency room and making it not function well. They had other kinds of emergencies that if they could eliminate these, the room would function much better. And so they took those patients, they gave them personalized medicine, they gave them the most advanced inhalers, et cetera, and they couldn't improve their asthma. They went into their apartments, and what they discovered was there were mold and cockroaches. And for an average of $2,300 per apartment, they cleaned it up, cured the asthma, and what they discovered is that housing was actually a health solution. In Boston, a doctor can actually write a prescription for a housing violation. They can actually write a prescription for a housing officer visit if they believe that health is a housing-based issue. So where are you seeing in the health side and in the education side, James, we'll start with you, these kinds of interconnections and solutions?
Yeah, it's a really great question. Actually, I'm from New York and spent some time in Boston before this job. One of the things that we have that is in the same space as your question is we started here, and I started one in Boston as well, what we call a medical legal partnership. So again, we know that sometimes under a broader notion of health, the best health intervention is a legal intervention. A classic case is a child who cycles in and out of our ER because he has asthma, and the landlord refuses to fix the lead-based paint and the chips that are causing it. And it's often just a call. We refer the person to a lawyer that we pay for, and it's generally a call from the lawyer, and the call inevitably goes something like, I represent so-and-so, we'd like you to fix this lead-based paint. The landlord inevitably says, no, I didn't know it was an issue. No, you didn't know this poor person had a lawyer, now fix it. Problem solved. The patient's not cycling in and out of the ER anymore. So increasingly, you'll see hospitals move outside their general spaces into spaces that are much more broader. We have some hospitals that have a washer and dryer in it because we see homeless people who are cycling in and out, and instead of giving them new clothes every time, you wash the clothes. It's a new space for our hospitals, and it's not a space necessarily that the doctors signed up for. But hospitals aren't only made up of doctors, they're made up of a whole host of ancillary staff that can help move the dial on health sometimes better than the physicians. A similar program we have is something we call our Community Health Advocate Program, where we have community health advocates, community health workers, who speak the language of the communities they exist in, and they help folks enroll in insurance. One of the largest factors to health outcomes is health insurance. We're lucky to live in a state where we have Medicaid expansion, but for those states that don't have it, people are dying as a result of lack of insurance. That's an access issue. And we realize in a state with a large Hispanic population, we need to do a really good job of making sure people get the services they need in the languages they understand, and that those types of kind of cultural sensitivities lead to increased trust, which can maybe even talk about sensitive issues such as immigration status. So those are two examples. I'll close with one other example. We are a large employer, and as a large employer with 22,000 employees, we need to do a better job of assuring that all the different specialties in our profession have a certain ability to communicate in the languages of the people that they're seeing. I live in downtown Denver, which I love. I'm from Queens, so I'm used to kind of getting on the train. So I take the train to work, and I'll tell you, it's longer sometimes to take the train to work down 25, down to Centennial, but it's a commitment. It's a way of life. It's something that I think we all need to commit to bending a little bit to improve the collective good under the notion of the common good is better than any individual aspirations.
Tell us about education, what intersections of education and housing and how that might work better.
Yeah, so there's two things I'm excited to talk about. The first is focused on housing, the second is focused on our students. So on the housing side, one of the things we're looking at is how do we use our campuses and the open space on our campuses to potentially lease out some portions of those to then allow for the building of affordable housing. And this is direct benefit on our own district. We have over 12,000 employees, and a recent study came out that Denver is the 7th least cost-effective market for teachers in the country. And so we have teachers that can't afford to live in the neighborhoods in which they teach, or even in the city at all. Not to say anything of the food service workers, custodians, or bus drivers that are vital to our students every single day. So we're trying to investigate how can we partner, some of the folks who are here in the room today, partner with folks in the city to bring about more affordable housing while letting us still focus on our core mission of educating children. So that's the first. The second is a citywide committee that we are launching next month called the Strengthening Neighborhoods Initiative. And this is to convene a panel of folks from across the city to help guide the district with ideas to our Board of Education on how do we need to think about our schools as the city continues to change. We have had research come out that says our schools are pretty segregated, and we have research that comes out and says that our neighborhoods are pretty segregated. And so we know that those things are mixed. As housing continues to change in the city, how do we need to think differently about our schools to create more integrated schools and create the learning environments that we need for our children to be successful? So those are two of the things we're excited to dig more into in the coming year, and I look forward to some of the partnerships in this room.
So as I mentioned earlier about the programming grant that's associated with our Healthy Housing Fund, just want to share how that came about and why we thought that was compelling. So it'll be my story. But when we made our investment to Mariposa, it was our really first huge investment to an affordable housing developer, and I don't know if there's any Denver Housing Authority staff here, I saw them earlier. I was excited about the built environment parts of the grant. You know, they're going to really make it increase access to food and physical activity. And then there was the staffing piece. So there were 2 staff positions, a healthy living coordinator and a patient navigator. And we'd been funding some of that work through our traditional healthcare space. But for me, just working in this sort of the new healthy living area, I was really excited. In meeting with the staff after the grant, or through the process of the grant, really learned that the staffing made such a huge difference to the lives of the residents at Mariposa. And I'll give you one example that really stuck with me. So there, and I think it was in the Tapiz building, one of the buildings, there was a huge number of calls to 911. You know, so some of these folks, they're, lack of access to healthcare, lack of resources, 911 is their only resource. So, but they were, as you can imagine, calling 911 from perhaps an issue that is not conducive to 911 does put a burden on the system for calls that are truly emergencies. So staff really helped to work with 911 and bringing an emergency Denver Health ambulance to bring staff in and to educate the residents around when to use 911, when not to, when to go to the ER, when not to, and really saw a decrease in calls. And so I find that so compelling that having staff on site, present, be a liaison, be a resource for residents, just has improved systems, connections, in every way, and that's just one example. They had many others on the healthy living side and getting residents to really engage in physical activity, which did take longer. There's some behavior change there, but many great examples there that really, for me, in some ways, lifted that side more than the built environment side, which was still very important because you need to have access to strong built environment features, but that staffing really helped to activate it.
Those are all great examples. I want to turn to the audience and see if anybody has questions. If you don't, I have another one, but I'd love to hear from you. You've been sitting so quietly, patiently. Does anybody have any questions? Well, while you're thinking of a question, I have one more question for each of you, which is, so here the city is announcing this fantastic integrative policy concept of, so what would be your advice to them? If you were going to advise the city from your point of view on what they could be doing, what are some of the things they should be doing to really create an integrative housing, health, education system?
Yeah, good. So for me, I think the advice that I would give is to make sure that we leave no one behind. All ideas matter as we seek to solve a problem that's complex and is encountered in many locations. Our mission statement as Intura is to carry on the healing ministry of Christ by caring for those who are ill and nurturing the health of the communities you serve. So there's a theological component of it, but no one has to believe in Christ to be a part of our organization. At the same time, there's a kind of preventive health focus, nurturing the health of the communities we serve. And that's not something that hospitals alone own. It's something that the education folks own and that we as a larger community own. So I think that's one part. And within that is this notion of empathy. I think that at times, regrettably, particularly on issues of behavioral health, psych and substance abuse, we do a good job of blaming people for things that they are not fully responsible for. We all know there are structural issues there. And I think that as a society, if we can turn from a notion of sympathy for individuals to a notion of empathy, meaning you put yourself in that position and you require action, a curiosity to someone's plight instead of walking by without thinking twice about it, I think we'd be in a different place. And lastly, I'll just say optimism. While we have some challenges, I'm tremendously on fire about what could have occurred in the state of Colorado and the city of Denver, coming from more kind of fiercely competitive markets such as New York and Boston. You see something here that you don't see in other places. I've only been here 3 years, so I can't fully put my finger on it, but I think there's something to that Western spirit, that pioneering spirit where you had to rely on your neighbors to survive that we still kind of embody here. So I think that we have some great opportunities to do things different because of that.
Fantastic.
I think it's acknowledging that if you pull one lever in a certain neighborhood, it could have some repercussions on another one of the stakeholders in that neighborhood, and acknowledging the complexity of that. At lunch, I was sitting with some of our partners from OED and talking about some neighborhoods where their view of something that would help improve the neighborhood could create stress on ours. And an example would be that it hits many more students in a neighborhood that were already jammed up with capacity and we don't have any more seats for the additional students that will come in, or a great project that will happen in a certain neighborhood, but that it may further segregation in those neighborhoods. It doesn't mean we shouldn't do any of those solutions. We have to do solutions. I think it's how do we connect together as early on as possible to think of what are the moving pieces that we have to go in the same direction. And I think when you have so many different organizations that are needed to help a neighborhood, it's trying to make those connections and figure out how to give everyone the best possible solution for that area.
Great advice, and the only thing I would add is engage, 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 and I think the city's already thinking of that with the Office of Hope, but engaging residents, engaging the end users. I mean, if you think of all the really successful examples of healthy communities or community of opportunity, it's where the residents really have that buy-in and engagement and the development of where they live, their daily life. They know it really well. And so there's so much going on in the city right now, and we have such amazing resources, all the different partners. So there's no reason not to do this. And I hope that the city continues to take that on.
So one last call for questions. All right.
To provide some support to Globeville, Swansea, and Elyria, being that we're currently going through a lot of displacement in critical times, and that, not saying the other communities are not important, but being that it's been mentioned constantly today, what efforts are being organized around those communities?
Maybe Rick, you could answer it.
I'll certainly give it a shot from the housing division standpoint. I mean, we work in collaboration with Jenny. She's one of the leaders on the Mayor's Housing Advisory Council in helping us kind of define what our plan's going to look like into 2017 and how we want to allocate resources. I know from the city standpoint and our nonprofit partners and DPS and others, we're trying to put together a collective strategy, and there's some great resident leadership, Jenny, including yourself.
Can I just add, from the foundation's perspective, we did fund the Community Land Trust study for GES, and so really looking forward to the results of that. And then certainly support the Family Resource Center, that Focus Points, that's really working, and others, other nonprofits. So we've definitely not, we've been very aware of all the efforts in GES and trying to make sure, that if we can, from our viewpoint, when we get applications in or requests in, to make sure folks are connecting, because I'm sure there's a bit of fatigue from residents in GES too of all these efforts, so really trying to keep an eye on that, at least from our point of view.
I'll just add, for every underserved communities that are part of our market share, every hospital has a requirement to do a needs assessment to see what the needs of that community are. And on our websites for the different hospitals, you'll see both the needs assessment, what the needs are, and a plan to address those needs. So I implore you to look at those and to say if we're not getting it right, if we're missing something that the data doesn't tell us, let us know so we can build it into our plans and work together to improve these neighborhoods.
We have one more question, and then we're going to end on time.
Can you hear me? Yeah, there it is. My name is Rafael Espinoza. I represent Northwest Denver on Denver City Council. That's District 1. I live in Jefferson Park, which is an area that has undergone rampant gentrification. If you look at all the gentrification studies that we did 2 years ago, you will see that Northwest Denver is the area that is under the most pressure for gentrification, has had gentrification and what have you. But I'm trying to put it on the radar. The Sunnyside neighborhood, our 41st and Fox Station area, because that's an area that is largely industrial, but it's mapped in a station area plan for high density residential. And what I'm asking you guys is, right now our policies and plans now, go to developers and they pull funds, but they don't require replacement of those, distribution of those funds in those areas where they're taken from. So if we're granting new development rights over there, they'll pay their linkage fee and go on, and because it's an area that is ripe for gentrification, they will go market rate. The beauty of the station area over on Sunnyside is we're not talking about a lot of displacement opportunity because it's primarily business, not households. But it is an opportunity, as far as I see, to start to create the housing opportunities that we didn't do in the last 7 years. What do you think we should be doing with our policies so that we're actually collecting that money and putting it back into those neighborhoods? Because right now is the time. We have about an 18-month window where we can start doing that, and I don't see the level of effort at the city on the Sunnyside area, the same way we're doing at Rhino and Arapahoe Square and other places. Thanks.
So on the policy side, first of all, on the affordable housing side, so in New York now, if you are rezoning an area from an industrial area to a housing area, it has to be a minimum of 30% affordable housing. I know that sounds extreme, it's hard, but if you just look at the numbers, if we're going to catch up, we have to take every piece of available land and increase its affordability contribution, particularly if it's land that you're not doing displacement there. But we are doing a kind of displacement there, and that happens to be of jobs. And one of the interesting things this is a housing conference, but we talk a lot about housing preservation. We don't talk enough about small business ownership or business preservation. And just as we're developing the financial tools for first-time home buyers and to try and get people into ownership or permanent rentership, we need to develop those for small businesses. And so when you think about a rapidly gentrifying neighborhood, one of the things that gets forced out are the small businesses. If they could be converted from renters to buying their buildings. I've seen many cases where the neighborhoods improve so much, the business stops being a business and becomes a landlord because they own the business, but then the gentrification, actually they benefited from it rather than getting displaced from it. So I ask that we think on both the housing side and the small business side. And do you have any thoughts about Northwest Denver and gentrification?
From the education side?
Sure.
Yeah, so we've definitely seen enrollment declines over the last 15 years. As housing prices go up, we tend to get fewer and fewer students from housing units, and so we've had some school consolidations in Northwest Denver over the past 10 years. For that project in particular, we're talking with a developer. There could be a substantial amount of housing units that could lead to more students. We do have seats in the area, but at the same time, I think we want to protect the schools that are serving that neighborhood, the Sunnyside neighborhood, over towards where that development will be. And I think this is something we're trying to do more across the city in other areas as well, where there are large-scale developments. We want to make sure that the local school that serves that area is going to be able to continue to serve the students that live there. And it's not just that we put more capacity pressure on that school or that the existing students don't feel like it is their home school anymore. And so I think we're trying to be increasingly intentional about those types of things, and that's certainly one of the projects where we're talking with the developer to ensure that the schools are well equipped to handle the future students.
Thank you. So first of all, I'd love to have some applause for James, Brian, and Con. We thank them not only for their contributions to this panel, but their contributions to Denver, and secondly for this amazing symposium that has been put on. Rick Padilla, thank you so much for conceiving of it, for leading it, for organizing it. It's events like this that really help build the community that shows that we're all in it together. So thank you.
Thank you. Fantastic. Okay, just two very quick housekeeping and then a final comment. If you parked in the building, when you check out, tell them you were at the Housing Summit and we will cover your cost of parking. Number two, Colorado ULI and many others sponsor a thing called the READY program, the Real Estate Development Initiative for women and minorities that are interested in learning about the development process. We have some flyers out front if you're interested. Recruitment runs for, I think, another week. It's a 6-month process. It's deeply intense. We have the University of Denver that helps us along as well. So finally, let me just say this. We started off the day with a market update and closed it out with the discussion about connectivity between housing, jobs, health, and education. I am a true believer that challenge leads to opportunity. Einstein said this about opportunity. In the middle of difficulty lies opportunity. Opportunity is missed by most people because it's dressed in overalls and looks like work. Thank you for participation. Have a wonderful weekend. Thank you.